Africa is facing what's been called a brutal resurgence of the coronavirus pandemic. The World Health Organization says the new wave threatens to be the worst yet. At least 14 countries are facing an exponential growth in infections. And unlike during the last surge, healthcare systems in several regions are struggling to cope. Making matters worse is the emergence of more infectious new COVID-19 variants and a shortage of vaccines. Less than 1% of people have been inoculated so far. Africa's top public health official, John Nkengasong, says it's a disaster in the making.
We are running a race behind time here because the pandemic is ahead of us. Let me put it very bluntly. We are not winning in Africa. We are not winning in Africa this battle against the virus. So it really doesn't matter to me at this point whether the vaccines are from COVAX or from anything. What we need is rapid access to vaccines to member states.
In a moment, we'll hear from another top African health official who says it's unconscionable that richer countries are already vaccinating adolescents when some of the most vulnerable people in Africa are potentially facing death. First, though, DW's Mariel Muller reports from one hospital in Kenya trying to cope with the onslaught of the third wave.
Screams for more oxygen. The intensive care unit in Kisumu Hospital, one of the biggest in Kenya. Nurse Nicholas Otieno has seen a third of his COVID patients die. You might think the patient is improving. They might talk to you in 1 second and then they just collapse and die. The ICU is full. Otieno and his colleagues are overwhelmed. They just lost another patient. We keep hearing patients calling for more oxygen here in this intensive care unit, and there are about 15 people who are struggling for their lives. And we just had to witness how a dead body has been removed out of a room full of patients. And as you can see, the space is quickly being filled again. The hospital director is worried. They need 5 times more oxygen and far more high-flow oxygen machines than they have.
And we in Africa need those high-flow devices. They are very expensive, so we can't afford them. We lose lives that could be saved because these devices are not available.
Health officials believe the number of coronavirus cases is much higher than recorded, especially in villages where people can't afford the transport to a hospital. Jennifer Owiti buried her younger sister 2 days ago. It went very fast, she says. A bad headache, fever, shortness of breath. It all started on a Sunday when we were in church. She felt unwell. By the time Saturday came, it was too much for her to bear. She was taken to hospital, and the same day she died. Death has come to this village. Residents say there have been 50 burials here in recent weeks. The only oxygen plant in the region has reached breaking point and won't be able to meet an increasing demand.
I'm getting so many calls from patients who need to be done home care, asking for oxygen regulators. If you don't assist them as fast as possible, then in the next few minutes, that patient will be gone.
Back at Kisumu Hospital, there's some good news. A patient who's been dependent on oxygen for weeks will be released soon.
Somebody should not joke around that this thing is real. When you want to taste life, just try to remove whatever they're giving you. When you are in treatment, then you'll feel it.
Luck was on his side. In a health system so overstretched, luck is what these patients will need.
Let's speak now to Professor Salim Abdul Karim. He's an epidemiologist. He recently chaired the South Africa government's task force on COVID-19, and he joins us now from Durban. Professor, it's good to have you on the program. What's your greatest concern right now relating to Africa and COVID-19? I know it's a vast continent, but what are your greatest worries right now?
Well, when we look at the current situation, the number of cases in Africa are going up quite rapidly. There is little question that Africa is currently gripped in the third wave. the number of cases have been rising about 20 to 25% week on week. Right now, we have something like about 14 countries in Africa where they are now in rapidly upward trajectories of their third wave. South Africa itself has a rapidly rising number of cases, parts of the country already experiencing quite a lot of pressure on the healthcare services. And of course, all of this is occurring against a backdrop of healthcare services that are somewhat fragile, and in the midst of overall low vaccination rates because of lack of access to vaccine doses.
Now, we've seen the rise in cases overall, as you mentioned, but COVID-19 has not been as lethal in Africa as elsewhere. Do we know why that is?
Africa, when it was dealing with the first wave, tended to have a wave that really wasn't as severe as many people thought it might be. There were all kinds of doomsday predictions of millions of people in Africa dying as a result, but we really didn't see any of that. And now we have a better understanding that due to many factors that we don't necessarily understand all of them, but among them is the general youthfulness of Africa that gives it some level of protection. Because the disease is most severe in the elderly, and Africa has a small number of elderly individuals, that we do not see the same kinds of pressures on the hospitals in many countries. However, that's balanced in that there are parts of Africa that have high prevalence of comorbidities like diabetes and hypertension, and so that factors in as well. We don't fully understand why the cases and the deaths haven't been as high. Some of it relates to underreporting, but even in the presence of underreporting, we haven't really seen overwhelmed hospitals in many countries in Africa. So I think the youth dividend is what we'll ascribe it to for now until we understand it better.
Right, and you've talked about the shortage of vaccines, the low deployment. What risk would Africa pose to the rest of the world if Africans are not vaccinated soon? And is there a risk of Africa being cut off from the world?
I think at a very fundamental level, there's a misconception and a misunderstanding about COVID-19. COVID-19 is a pandemic. It is a disease that knows no boundaries. If one just takes any one of the variants, within a matter of 3 months, they've already spread to 100 countries. So there is no scenario in this world where a country can go on the basis that it will vaccinate its population and that all will be well, while the virus is spreading rampantly in the rest of the world. That is not a winning scenario. We have to treat COVID-19 as a pandemic, and we've got to suppress the virus and the transmission of the virus globally if we are to make an impact. And so, we really need to deal with it in that way, and that means equitable distribution of vaccines. It is not a solution where one country, hoards vaccines and vaccinates its own population. Indeed, it is unconscionable to me that some countries are already vaccinating adolescents, while most countries in Africa haven't even yet completed vaccinating their high-risk healthcare workers or the elderly.
Professor Salim Abdul Karim, one of South Africa's leading epidemiologists, speaking to us from Durban.